Hi, I'm Olivia, and the community that I've chosen for the assessment project is the community of Batavia, Ohio. And I chose this community because I've grown up here my entire life, and I have a passion to see the community members as a whole just grow and flourish in ways that they haven't experienced before. So a little bit about Batavia. It's located on the southeast side of Cincinnati within Claremont County, and it sits in between Williamsburg Township and Union Township, and it's not very big. The current population is about 23,000 people, but it's growing daily. So through my research and through the resources that were available to me and my observations, I was able to gather that the top three strengths of this community are, first, the plethora of resources available. So there's quite a vast amount of resources that will come in handy. There is a willingness to learn amongst the community as a whole. They definitely have an attitude of openness and are willing to make changes. And the last one is that about 85% of the population as a whole is insured and has access to health care, which is relatively high compared to other townships nearby. Now, alongside the strengths, there are some risk factors or weaknesses that have been identified through surveys, public forums, and just things that I've observed. And those would include obesity, tobacco use, drug addiction, and mental health. But the one priority problem that I really want to focus on was drug addiction, because not only is that something that we've seen as a big issue in the Cincinnati area, but also in the Cincinnati suburbs. It's not something that's just inner city, and one of the big reasons is because of the heroin epidemic around our area. But within Batavia itself, in the past year, there have been 80 deaths related to accidental drug overdoses, which is really high. So my goal in this assessment project is to improve the education on healthy coping mechanisms for stress or difficult situations in adolescence. What we've seen is that a lot of children and adolescents that have experienced trauma or stress and have not dealt with it later in life can turn to drug addictions, alcohol, or other harmful coping mechanisms. So my objectives in order to reach this goal is to implement an educational course at the local high school where students report improved stress reduction, and to implement an educational course at the high school where students improve their education on coping strategies. So some ways I want to achieve these objectives are through my interventions, and my interventions are primary prevention focused. It's going to be education on preventing drug addictions from happening in the long run. So these will be implemented at Batavia High School. The first one is to educate the students on alternative ways to cope with trauma and stress and have them report it back. And then the second one is to implement a peer support group where students can share in their daily struggles and alleviate their stressors of life with one another. These interventions are really easy to implement because you can speak to a mass amount of people at one time. And it doesn't require a lot of resources necessarily. But speaking of resources, some of the main partnerships I'm going to have alongside me is definitely a collaboration with the school board officials on implementing a routine and mandatory assembly on drug abuse, drug prevention, intervention, and resources for treatment. That's something that I want to nail down like every year, something that's consistent. Also, I'm going to be working alongside the school nurse to provide the education to her students or his or her students. Then there is the Claremont Recovery Center, which would provide me many resources including addiction treatment interventions, education on prevention. They would just be able to give me more resources and handouts that I could provide the students with, as well as the National Institute of Drug Abuse. They have a ton of clinical resources for nurses to provide their patients, including videos, which I find would be very helpful when presenting this information to the students. And next I have to look at how I'm going to evaluate this all. So with my interventions, in order to evaluate whether or not they were effective, first I would like to have the students fill out a survey before they start the educational course, and then another one after the course is finished. And I would compare the results of the survey to see if the educational course is effective in improving stress reduction, and it also just gave me ways to improve this moving forward if I were to implement this routinely. And another way that I would evaluate whether or not this was effective is I would incorporate a teach-back method with the students to look at their understanding and comprehension. At the end of the course, I would give them an assignment to present what they learned about coping strategies and the effectiveness of each strategy to the class. It would be like a presentation, and this would give me the opportunity to really assess what they have learned and determine if the course was effective or not. And lastly, what I've really learned through this project is that community nursing really isn't that different from like a bedside nurse. You're still looking at the population as your patient. Yes, it's a little bit bigger, but you're just looking at, okay, what is the need? What do I really need to focus on? And what do I have available to me to help me capitalize on just how to treat this patient or people? You know, I think at first I was a little intimidated because I was like, community sounded like a really big, vague thing, but once you look at it step by step and you're able to kind of see the similarities of, okay, yeah, this is very similar to just treating one person, larger scale, but there's a lot of parallels there. And so that was really cool to come to a conclusion like that, because I realized that there's not a whole lot of difference there. Overall, it just gave me a good outlook and perspective on what community nursing really looks like, and I'm very thankful for that.